the Sultan Kudarat One Hospital Command has engaged the services to assist in the development of a referral system in healthcare facilities. Establish a referral mechanism to ensure quality healthcare is delivered to clients.
And I am truly grateful for your enthusiasm to partner with us in Sultan Kudarat Province. Para I get to know who our visitors are. And ito naman yung grupo natin sa One Hospital Command. That's very good. Yeah, sige po ma'am.
I'm Dr. Charmaine Silalan Mbay. Very grateful kami that you have allowed us to benchmark with the OHCC of Sultan Kudarat. Basically, I'm the head of ICT Department of Surgeon General Hospital. Thankful kami kasi you have allowed us to benchmark. This would be helpful for us in preparation for the UHC kasi we know naman na we have to be ready for it. So this is part of the big plan. This will help us a lot in slowly evolving to be what we want to be.
Yes, thank you. Kami naman, masaya kayo kasi it's going to be our first regional hospital. Our only regional hospital now. And dito na kayo muli sa South Cotabato, which is closer nearer to our people and constituents. And we believe that with your presence, we elaborate further the words that we want to deliver to our people, lalong-lalo na po yung mga servisyo na nais natin ibigay. So with the enactment of the malasakit, and with the universal healthcare, and with the new laws coming up, maraming bills pala nung nakasilip yung ate ko sa Committee on Health, we are very much happy na ngayon pa lang ay maganda na ugnayan ng regional group, pati ng provincial group. That way, we can enact systems kung saan perhaps may kulang sa amin na dapat dyan sa inyo, o baka at this moment na nagsisimula pala yung group dito, we can be of service din as well. Mula pa lang yung region, ay nandito kayo for you to also take a look at and learn what we've been doing here in Sultan Kudarat Province. Our innovations here may be different from other provinces. Other provinces may have innovations na wala sa amin. Okay? May kanya-kanyang beauty yan eh. And that's the beauty of everything na pati nga kami. No matter how intelligent or how high you are, you must always seek opportunities where you can learn. Yeah. But thank you for coming and visiting us here. Hopefully this won't be the first or the last time that we'll be meeting each other. Maybe one day, ako naman pupunta doon.
Spoke in the level of support, consulting to ensure the initiative is a success. Working with our technical officers from the Provincial Health Unit, PIDOHO, our private and public health sectors, our patients who are very important stakeholders in the process, consultation on how the system works for them and what they would like to see as well. They are very important stakeholders in how we improve on the referral process. During assessment period, looking at what presently exists in our system, doing visits on our various healthcare program, looking at various ways and gaps, ensuring that we can put the system in place so that we can have an integrated health system. This initiative is extremely important given the gaps identified in the healthcare system. We are able to note the deficiency in the transfer of patient care from one sector to the other. Our medical professionals are able to determine where these patients are referred, to who they are referred for additional or for specialized care, and why these patients are being referred. We also need to be able to track the patient throughout the healthcare system. When they go to the primary healthcare facilities, what kind of advice are the medical professionals giving to them? Are they taking that advice? Are they following up with the referrals? Focus group discussion, visit to various healthcare facilities and stakeholder meetings, to name a few, reporting from the communication unit. Develop a digitalized system, which is the way of the future. Being digitalized, files cannot be lost. They are therefore the purity, very secure way of actually referring confidential, comprehensive referral system. Referrals were being triaged much more sooner than the proper referrals extracted from your best practices. Utilizing it in conjunction with health pathway, you are exactly what you want for the patient, and they can be seen in a timely and an efficient manner. This referral system uniquely integrates structured healthcare pathways. We note how it will affect the quality of care that the patient receives, as the healthcare providers is not fully informed or informed of what care management they receive when they get out of one sector.
And also from the video home office, Dr. Mercedes Mananza and Sir Bernard Castillo. And Sir Marlon.
From the OHCC, magandang hapon sa lahat. And on behalf of our Honorable Governor, Honorable Dr. Fox Mandato, welcome ma'am sa Provincial Command Center. This is also the one hospital command center of the province. I would really appreciate your visit dito ma'am, because you're the first na hospital outside Sultan Kudarat na nagbisita sa aming Bogino. And with the hope na makita niyo mga system na ginagamit namin, ang referral system, and also the tools that we're having to ensure that the referral or medical referral of our constituent coming from different municipalities and cities are spontaneous and efficient. So, hindi sa pag-visit niyo sa amin, and as we go on with this program, we'll start with the very short presentation for you to understand how we do things in the one hospital command, and eventually after that, we'll be going to the center itself and for you to look at the reports and the system that we're living in the referral system. But again, welcome po sa pag-visit. So the sequence of my presentation are as shown. So we have the legal basis.
Do benchmark here in our one hospital command, because for the reason that OHCC is one of the best practices of Sultan Kudarat province, and that was 2020 when it started during the pandemic. But until now, the OHCC is very useful in terms of referral of patients. Before, we only refer COVID patients. But now, include na yung mga COVID patients. Last year, we had this orientation of universal health care, no? And it was funded by our former Governor Suharto Timothy II. And together with that orientation, the One Hospital Command was integrated because it is the part of the universal health care. So ever since naman, the Hospital Command has been very useful. And it was included also during the discussions in the local health board kung may mga problems po regarding sa referral of patients. And until now, I would like to congratulate po the One Hospital Command for the good practices that it had ever since. Yun na nga, ano nga sir yun? No borders. Opo. So,
medical attention at the right medical facility.
yes po, may mga ano sila sir yan, no? Oo. So, lahat po na aabot na po ni One Hospital Command. And our former governor, no, has seen the importance of issue to the infirmary hospitals, level 1. Parang gano'n na rin po yung healthcare provider network din natin na type of referral. So once again, salamat po at pumunta po kayo dito, Doc.
I am very grateful na we have been given this opportunity by Colonel Morenga and all of you. No, I am very grateful na nag-allow mo kami. You have really welcomed us well. So why do you think we're here? No? Bakit ba kayo nandito? Seen kung gaano siya ka-efficient, and I have seen how it saves lives. No, and it is very important na we communicate. Importante talaga yung communication. We communicate with each other through electronically. No? Paminsan kasi pag nagtatawagan, ang gulo. Whereas eto, ayan, hindi ka na pwedeng maghindi sa pasyente at saka ng vital signs. Diba? So, ganun siya. So, very helpful talaga. That's why I was asking my staff sa Surgeon General Hospital because we want to be ready for the UHC. This is in preparation for the UHC. It just so happened that I left Columbia Infirmary, transferred to Surgeon General Hospital, and being head of the public health unit as well as the ICT, wala silang choice na dito sila. We really see it na kailangan namin ng ganitong klaseng sistema kasi eventually we will become the regional hospital of surgeon. And without this kind of system, I don't think that we can function as optimum as we should be. So I am very grateful also kasi sinamahan ako ng HEMS namin na coordinator, si Dr. Gambong, who would also be part of the UHC of SGH. Actually, siya yung supposedly kanya to. Pero, syempre nag-vote na lang po, no? Para lang na ma-startan because we really want to position ourselves to be ready for UHC. So this, with the PHU and the whole system, eventually we will share, kumbaga pa, knowledge and inputs. You have a lot of information. Grabe, ang sarap magawa ng research because we really have a good data. So, ako medyo data-driven kasi ako, so I really want this kind of stuff para yung decision making is easier for us on the admin side to see things with the data that you give us. So, yun din yung gusto kong mangyari with the ICT namin. So, thank you for having us here. Thank you for welcoming us. May mga questions kami para maka-learn kami. Please, I hope na we would learn from each other as well. So, this will pave a way somehow. Maka-help ito para pa-ready kami na ma-equip, na tulungan nyo rin kami na maging equipped bilang regional hospital ninyo. So, with that, thank you. I am very grateful sa pag-welcome. Very warm welcome. Salamat po. Salamat po sa inyo.
The experience with the universal healthcare programs in the province in the span of almost 2 years has been positive, dynamic, and proactive in form. First, from the birth of the Sultan Kudarat One Hospital Command Center for patient optimal navigation as an acid test of universal healthcare in the province. Second, moving into the greater parts of the chain is the pilot implementation of healthcare provider network in the 11 municipalities and one city that bears the full support, commitment, and resource aid of our former governor, Governor Suharto Teng Dato, and the continued support of our governor, Governor Dato Pax Ali Dato, that amplify their vision for a healthy Sultan Kudaratenios and a province that provides health management without borders. The goal is to build a one big helping hands to work together towards a common objective beneficial to every constituents of the province. A strong leadership built and established by an efficient and effective health system. In the journey toward universal healthcare, the province is seeking balance between control and risk affordability, innovation, and competition consistency as we start small and aim big. To give the right medical attention at the right medical facility without borders for every Sultan Kudaratenios and nearby provinces. This benchmarking and adoption of coherent health policies has the flexibility to respond to health developments, useful for planning, decision to achieve an equitable health system towards an effective universal health care. We're so glad to have you, our friends from SKOHCC General Hospital, headed by Dr. Imbay and Dr. Gampong. We are truly honored to have you here for your benchmarking activity.